The fertility rate in the U.S. has dropped to an all-time low. From 2023 to 2024, birth rates declined across all age groups under 35, except for mothers in their 40s, which increased 2% from 2023 to 2024. That's according to a new CDC report. This is another recent CDC report notes that babies born to Black moms and rural moms and teen moms have the highest death rates in the U.S. So for more on this, let's bring in emergency psychiatrist and lifestyle medicine doctor, Dr. Adjoa Smalls-Monty. Thank you so much for being with us, Dr. Adjoa. Over the past 2 decades, the birth rate in the U.S. has been on a steady decline, with women either choosing not to have children or waiting until later in life. What do you make of these changes, and why do you think that we're seeing it happen?
So thank you for having me, Janae. The rates have declined. Many reasons for that are that people have planned their pregnancies a little bit more. We have access to contraception. People have prioritized their careers. People are also thinking about the financial resources that are required to raise a family. And so that is one of the reasons why or a few of the reasons why the birth rates have been declining in the United States.
It is really interesting because obviously having a child is very expensive. And so, yes, seeing those numbers later in life for women over 40 and also seeing fewer teen pregnancies is really interesting to see. And a new CDC report found that the infant death rate was the highest among babies born to Black moms, rural moms, and teen moms. Why is that? And what can be done to prevent these deaths?
Yes, this is a very sad statistic, but something that is not new. And it's sad that this is a problem that continues. And so some of the reasons why the mortality rate is higher in Black moms and rural moms, in young mothers as well, as one, it could be access to resources, to obstetric services. In rural areas, you may not have access to the specialist doctors in case you have certain complications. We know more and more labor and delivery units are being closed around the country, so we need to focus on funding these type of units. In addition, transportation might be a problem in rural areas, so it could take a long time to get to the hospital or to get to a clinic where you can get your regular maternity care. In addition, there are also the other socioeconomic factors that do cause difficulties in your pregnancy and in your delivery. So poverty can affect your nutrition, your clinics that you are able to go to, but also there is racism that exists because there is no reason why Black mothers should have a higher rate of mortality, why Black babies should have a higher rate of mortality. It is the racism that exists in terms of how Black women are listened to when they complain of pain that can denote that a problem might be occurring during their labor and delivery, during their postpartum period. There have been too many sad stories. And so there needs to be more awareness, more understanding, more treating people with concern when they bring up things that are happening during their pregnancy. But also, this is for people anywhere. It's not only Black women, although that is a higher statistic, but it is all women that are going into the hospital that are having a child. We have to take their concerns seriously.
So many important things you touched on, the underlying issue of racism that we've heard so many experts point to, and the maternal disparities that we've seen, and also the maternal care deserts that impact so many Americans around this country when it comes to getting the health care services that they need. Dr. Adjoa Smalls-Monty, thank you so much for being with us.